Hi, my name is Tycel Phillips. I'm an associate professor at the University of Michigan in Ann Arbor, Michigan. And today, the question is, does upfront treatment with venetoclax, lenalidomide, or rituximab enhance tumor responses in mantle cell lymphoma? So as part of our initial phase 1 study, our goal was to see if there was any augmentation of treatment with the addition of venetoclax to the treatment of lenalidomide and rituximab. While the study is still very early on and a lot of the outcomes are still to be determined, we did notice a very high complete response rate with the combination. And we also noted a very high molecular remission with this response rate. Now, molecular testing was conducted using the adaptive assay, next generation sequencing assay by Adaptive, which looks to evaluate for molecular evidence of the tumor within the peripheral blood of the patients we enrolled in the study. With this assay, we were able to detect tumor cells up to the 10 to the negative 6 in the peripheral blood. Concurrently with this study, we did obtain flow cytometry from pre-treatment samples in the vast majority of the patients enrolled here at the University of Michigan, which was 24 patients. Out of those 24 patients, we did notice peripheral blood evidence of mantle cell lymphoma in 23 of these patients. As of today, of the patients enrolled at the University of Michigan, we have 2 patients who have yet to obtain MRD undetectability by the adaptive assay. So taking all that into account with the CR rate, and again, having at least 21 of 23 of the patients who had detectable MRD at baseline currently being MRD undetectable, we do feel like this treatment regimen does deserve further exploration, at which point we are planning to expand the study to enroll another 50 patients to get a better assessment of treatment response. The patients enrolled in the original phase 1 study will be rolled into this phase 2 study so we can continue to assess progression-free survival in this patient population with the hope of having a true sort of determination of whether this treatment does enhance tumor activity in mantle cell lymphoma can be compared to some of the more well-established regimens that are used today in this patient population. Thank you.